What do we got on you?
Hey, well, I hurt my back recently. My SI joint has been a little jumbo, I guess we could say. It is feeling better, but it's because...
How's the neck?
The neck's okay.
Okay.
The neck's fine.
Neck's been good.
The neck's been good. The back
just
is
that SI since the...
That SI since
that at your place.
Yeah. Picking up laundry. Like nothing... I wasn't doing anything I wasn't supposed to. Or maybe. Maybe you're supposed to do it.
Okay. So that SI. Okay.
Yeah.
We may do some therapy.
Have I ever done Softwave on my ankle? Because that's my other...
No, we've only done laser.
Yeah.
Let's try it on the ankle.
Long-term injury.
That's a long-term injury.
We could try Softwave on that too.
That would be awesome.
I'll warn you. Have you ever had Softwave at all? I don't think you.
No, I've heard about it.
On a foot, like knees, it's sore. It's it's supposed to be like we know it's working because you're between a 5 and a 7 out of 10. Feet are just naturally a little more sensitive. So yeah, we can definitely do it. You'll just have to communicate really good. Okay, so maybe we can do Softwave there too.
Okay.
Radical therapies or laser or all of the above.
Okay.
You ready for the mermaid?
That's right.
Here we go. You gotta let me know if that pull's too heavy on that SI joint. How's that pull feel?
That feels just fine.
Good. Shaking here. See, you're going a little short, right, too? Not quite as far as Paul was. See, look, see how when we bring her together, she's just got the tiniest short right. Okay, we're going to do some drops. Lifting up. What was it you said? Oh, that was funny. Big drop. 1, 2, 3. Good. Down on that hip. See, and what's interesting with the pelvis, it looks big and crazy. Like on the camera, you're like going, whoa, but really all we're trying to get from the pelvis is speed. It's just quickness. So the pelvis doesn't do... Yeah, now it's gone. So I'm going to try to pull it down to pull that other one back to where it needs to be. And we almost went too far. And so you're just trying to kind of go really quick. You kind of just... That's about as good as we're going to get. It could even just be my positioning. Yeah, she did good. Come on to your side. Face me this way. Good. She's an old pro at this. How's that side feel? Good. Right up there. Okay, give me a deep breath in. And all the way out. And then fall. Good.
That was good.
Yeah, that was a lot. That was a lot. And out. Good. Nice. But I'm going to check her hips, knees. So hang on there. Let it wobble. Good. Let it fall. Not bad. Not bad. Which ankle was it? That one. Not bad. Moving good down there. Let it fall. Yeah, moving good. Pretty solid on all that. And out. Mostly that lower. There?
That first one was like the best I've ever had.
Yeah, that was good. That was really
On
good.
cue.
That was on cue. Uncrush your feet. There we go. It'll throw it crosses the hips and then it pulls one side on the neck. Just gonna go this side.
the older
Yeah.
one, not the one that was.
Okay, there's the dad and the son.
Yeah, I saw the dad, and he said that I had pulled something out of my foot, like a tendon or something right here.
Okay.
And so he put me on steroids and told me not to use it for a month, and I did that. And then while I was on the steroids, it worked great.
Okay.
But
So that's where he put it, though?
it was just an oral system.
Just an oral. He didn't, no injection.
No, but like if I push hard enough,
That's the spot.
It's yeah.
Okay.
It's been a year.
What we'll probably do then, I'm going to probably have you go face down. So you said it was more along that outside?
So
or more inside?
This is where I heard it a year ago.
But I can see the surgery.
But this area typically aches
A
a
lot.
lot of the time.
Okay. We may do a little of both, okay? Here comes some gel. I'm going to have it set relatively low because it can be kind of tender. I'm going to go pretty slow here at first. Alrighty, Miss Laura, I'm gonna start up here where it shouldn't be too bad, so you can kind of get a feel of what we're gonna do, and then I'm gonna come to this side first, okay? And then I'm probably gonna swing it up and over here, and then come to the other side. We're trying to find pain points, so wherever it hurts, you need to say, yeah, right there. And then when we're there, the next question I'm gonna ask you is, what pain level are we at? And you're gonna give me the pain level. If it's like a 3 or 4, I may go up a bit. If it's 7 or 8, like if you're holding your breath and want to move your foot, then we're going to lower it down, okay? Okay. Start up top. Here we go. Doing okay there? Okay, I'm coming down. No pain?
I would say minimal. Right there.
Right there. What's our pain level at?
I'd say probably a 3.
3? Okay, I'm going to increase it here, okay? What are we at right there? Am I on it still?
Yep, you're right on it.
What's
That's
our
a 4.
4? Let me go up one more. What are we at?
Yeah, that's a 5.
That's a 5? You're not going over a 7 though?
It's not a 7.
Okay, we're going, speeding it up. Am I on it?
Yep, you're right on it.
Is that too much?
Nope. So what's the idea behind the Softwave?
So the Softwave mimics an injury. So you know how you've had this thing forever? So we're kind of trying to convince the body that this is a brand new injury and that we need to send a whole bunch of stem cells back into the area so we can get some new healing. It also breaks up adhesions and scar tissue. This was originally used for lithotripsy, like this technology. Lithotripsy is to break up kidney stones.
Oh.
It does work well on acute injuries, but since acute injuries already have a pretty good flow of stem cells, I mean, we have stem cells in our body. Am I still on it?
Yeah.
Okay. But these old injuries, it's tough, you know, and so it's hard for the body to like get healing, to want to do anything with it. Plus, then you get these adhesions, it scars up, and that just doesn't work very good. So we get these chronic pain in the behind. All right, I'm going to slow it down again and start searching again, all right?
Okay.
Okay, here we go. I've still got it at that setting we had too, so if it feels too high.
Right there.
Right there, what are we at?
Probably a 5.
5? Okay, I'm going to speed it up, okay? We also get these high arcs. You know, you can feel every once in a while one will... Is that too high?
Mm-mm.
You sure? Am I on it?
You're right on it.
I'm going to do one more little search underneath here, okay?
Okay.
Slowing it down. Coming up. You're okay under there?
Mm-hmm.
That's all good.
It's
Nothing there?
crazy how you can walk around all day, no problem, and something like this can just find.
Yeah.
I've got problems right there, you know. It
Yeah.
hurts.
You're just there. Yeah.
Over here?
Kind of. Yep.
Right there?
Mm-hmm.
Is that and that's a new spot, right? Like that's different than the one that we had before.
Oh, yeah.
Is that too high?
No, it's just kind of like the one.
Yeah, the high arc.
That's all too high.
That's too high.
Mm-hmm.
Dropping it down. How's that?
That's okay.
That's okay? You sure?
Yep.
I'm going to put a little arnica on it too. Okay, so here's the deal, because you've never had the Softwave. The deal with Softwave is you want to avoid any anti-inflammatories for 24 to 48 hours. I usually just say 24 hours. So no, and really to me that usually means like ibuprofen.
Mm-hmm.
Avoid ibuprofen. Don't do ice for about 24 hours, but you can do heat. If you have to do just like a pain reliever or something, you can do it. It's supposed to, like right now, immediately when you put your foot down, most patients immediately are like, yeah, that feels good. And then tonight into tomorrow, it can get a little achy and sore, almost like we've done a PRP injection. And that's normal. So if it's a little achy and sore, you don't have to panic on that. It's working. And then it gradually starts to calm down. And if you want to do it again, we typically want to do it within about a week. And usually we'll just do it again until... Now, towards the end of treatment plans, we'll spread it out further than that because we're trying to like see how the body's actually really doing, you know?
Right.
But towards the end of the treatment plan, we may spread those out just to kind of see how they're really going.